Hello, everybody. Welcome to the CIJ Summer Conference 2021, our second fully online event. It's a shame we're not in the room, but of course that means that lots of you from all over the world can join, which is great news. So we have an excellent lineup here today for you. We have Natasha Loder, the health policy editor at The Economist, and also co-host of the JAB podcast. We also have Shadab Nazmi, a data journalism at BBC South Asia Bureau, and he's going to talk about numbers. And we have Supriya Sharma, who is executive editor of Scroll.in, which is an independent digital news organization known for its investigations. And last but not least, Lou Del Bello, who is going to be our moderator, and she is a journalist also based in India, specializes in climate and energy journalism, but also recently got an award for that writing and also health. So you will be able to ask questions. Please use the Q&A function, not the chat function, because it's much easier to use, and you can upvote questions as well. You can chat in the chat function, but questions please in Q&A. And also please share this on the social media using hashtag #CIJSummer. And now I'll leave you with our panelists and moderator.
Hi, everyone. Great to be here. And it's great to meet our panelists today. It's very exciting. As Marina said, it's sad that we cannot be in the same room, but it's great that we can do this online from different parts of the world. Natasha, are you in the UK?
I'm sorry, I didn't catch that.
Sorry, I'm very quiet. That's my laptop. I'll try to shout. Just wanted to ask if you're in the UK, because we are all in Delhi.
Yes, I'm in the UK. I'm in London. Greetings, everybody.
Second home for me. Great. So I think we could start because we're discussing the COVID crisis in India and all that's happened in the past few months. I'd be really keen to hear, start us out hearing for Supriya and what challenges did you face in reporting on this crisis? So for us in Delhi, it all kicked off in the space of 3 weeks. So I imagine there wasn't that much time to prepare or plan any sort of emergency coverage. So what was your experience? You are muted.
Supriya, you're on mute.
You're still on mute.
I'm so sorry.
That's all right.
I'm audible now. Right.
I'm very quiet, so.
I often end up making this mistake. I forget that I've muted myself and then I blabber on for some time before I realize that. So sorry about this. Thanks for having me here. I'd like to start by giving you a sense of our newsroom at Scroll.in. We aren't small, we are tiny. Until recently, we were just about 5 reporters and writers as part of the news and current affairs team. When the pandemic struck, we didn't have a full-time health and science reporter, and we still don't. And yet we've been able to do some important stories, well, not just in the second wave, but actually starting right at the outset when the pandemic began in March last year. And I'd say that's mostly because we're committed to covering the news through an investigative lens. And no matter what the story is, we try to look for information that isn't readily available. We try to examine what public authorities are doing. We try to hold, power to account, all the traditional values of watchdog journalism that sadly large sections of the mainstream media in India have forgotten. Well, coming back to Scroll, I just like to start by saying that it's true that in the absence of a health and science reporter, it's been very challenging for us to cover the pandemic. We've been constrained in the kind of stories we can do. We can't do very sophisticated reporting, for instance, on the science of vaccines. Yet we've been able to draw upon our experience covering the government, covering governance, to produce investigative journalism on the governance side of things, basically looking at the lack of preparation by the government, abrupt and ill-thought decisions, mishandling of supply chains, and so on and so forth. For instance, last year, in the early phase of the pandemic, when it was apparent that there was a shortage of protective gear for health workers in India, my colleague Arfa Johri probed the chain of events within the government to basically explore what led to this delay in the manufacturing of PPE kits. Similarly, we looked at the shortage of testing labs in India. I traveled to Uttar Pradesh, which is India's most populous state. It has a population as large as Brazil. And there I found that there was just one testing lab catering to 30 million people. It could just run 1,000 COVID tests in a day. And that was at the time when, the first wave of the pandemic was building up, and there were people who were waiting for like 10 days for their test report, by which time often it was not very useful. This year, when the second wave of the coronavirus pandemic was still building up, we kind of anticipated that a terrible oxygen crisis is going to hit the country. We started paying attention to stray reports here and there of hospitals that were running short of oxygen in small towns. They weren't, that story wasn't really getting much attention, but we sort of began to sort of notice the first early signs of the crisis. And around the same time, the government announced with a lot of fanfare that it was setting up 100 oxygen plants in district hospitals. And as we saw the press release, we were like, wait a minute, what happened to the oxygen plants that you'd announced last year? And so that's the question that we began to investigate. And what we found was rather shocking. One, that the government had taken 8 long months to invite bids for these oxygen plants. And 2, 6 months had passed by, and most of those plants were still not up and running. Just to sort of give you a sense of the timeline, as everyone knows, the pandemic was declared a medical emergency in March 2020. Everyone knew right at the outset that the most essential thing to tackle COVID would be oxygen. That's actually the most important medicine that we have in our arsenal. And by September, India's daily consumption of medical oxygen had gone up by 4 times compared to the pre-pandemic level. This when the number of cases in the country was still fairly low. And again, as everyone knows, there were predictions that the cases would rise and that they could rise astronomically. And so it was just common sense that the country needed to invest in creating, medical oxygen capacity. Now, again, to give you some background, India produces a large quantity of oxygen for industrial use. And so it would seem that the country, would have ample industrial oxygen, which could be redeployed to serve medical needs if required. At least that's what the government claimed in press conferences last year. But what it didn't acknowledge was that oxygen from industrial plants was clustered in a few corners, mostly actually in Eastern India. And to make it available to the rest of the country would be a huge logistical challenge. It would require cryogenic tankers. Hospitals would need to build storage, basically heavy duty logistics, and which cannot be built overnight. A better solution would have been to not depend on industrial oxygen, rather to build small scale oxygen plants within hospitals. And actually, these are the oxygen plants for which the government, after 8 long months, finally invited bids in October, about 162 oxygen plants that could be set up within hospitals. The cost was actually a pittance, just about 200 crore rupees or $27 million. The contracts were given out to companies in December. And so presumably by April, when the second brutal wave hit the country, most of the country, we would assume that the 162 plants would be up and running. And in fact, as we spoke to industry players, it actually just takes 15 days to get a plant installed. And at the very, taking like the highest range possible, you would say about 4 to 6 weeks is all that's needed to get a plant up and running. But then when stray reports began to emerge of hospitals running short of oxygen, our hunch was that, the bids were invited in October, the contracts were handed out in December, but 4 months later, these plants were nowhere ready yet. And so to investigate this, what we did was we pulled out, the list of the 162 hospitals that were going to get these oxygen plants. And 2 of my colleagues, Arunabh Saikia and Vijayta Lalwani, began to make phone calls to hospitals on that list. And they managed to get through to, authorities in about 60 hospitals across India. And what they found was that of these 60 hospitals, oxygen plants had been installed in just 11, and only 5 were operational. We then sent questions to the health ministry, asking them for information on the status of the 162 plants. They did not respond. We shared our data with them and saw their comments on the delays. Again, our emails were completely ignored. We finally went ahead and published our story. By then, the oxygen crisis had turned very severe. Many more people were dying because of lack of oxygen. And so we began our report with one such story of an elderly journalist in Lucknow, the capital of Uttar Pradesh, who tweeted till his very last breath asking for oxygen. He lived a short distance away from one of the hospitals where one of these oxygen plants on that list of 162 was supposed to come up. It hadn't. Within 2 hours of our story going up on the site, the health ministry tweeted acknowledging that of the 162 hospitals that were supposed to get oxygen plants, only 33 had them installed. The ministry did not actually put a number on how many of them were operational, but going by what we had discovered, that of the 11 plants that had been installed, only 5 were operational. It's fair to assume the actual number of oxygen plants that were up and running was smaller. Finally, with the health ministry's tweets out, the rest of the media was on the story. And over the next few days, tragically, deaths due to oxygen shortage became the defining story out of India's very brutal second COVID wave. Well, even though we did manage to put a spotlight on government failure, I regret that we didn't do this sooner. I sometimes wonder if we had investigated the delays in the setting up of oxygen plants while the case numbers were still low. Maybe it would have built some public pressure on the government to speed up its efforts. Sadly, we're a tiny newsroom, and it's quite a challenge to balance coverage of all the various crises unfolding in India. And so this somehow fell through the cracks. But the experience of the second wave I think it's just been so shocking and so numbing for all of us here that we've kind of redoubled our efforts to raise contributions from readers and supporters who value our work so that we can hire a full-time health reporter. And I'd like to just end on what I think is great news, that from next month onwards, our newsroom will finally have a reporter whose job is to track the pandemic. And I hope our readers will continue to support us.
Good news. Yeah, and I think the delays sometimes, living here is something that and interacting with all journalists locally, international reporters and local reporters, the impression was really that the pandemic was over after this first wave. So I think we were all caught by surprise to some degree, although the signs were there, but also the government messaging was that, we can finally breathe, no problem, the country's reopened. So it's something that I think happened to everyone, like big and small newsrooms in the country. So I wanted to hear from Shadab. You were muted. Yeah, so what was your experience from a bigger newsroom? And within your specialism, obviously you deal with the data aspect of the story. And the story has been, especially in the past few months, really fast evolving. How did you go about finding the right information and also challenging what was a wave of misinformation? Like in India, there was this big problem of bogus information circulating on social media, the WhatsApp University, and so on. So data journalism really acquires even more of an important role in light of this particular context. So how did you plan for your stories, and how did you tackle this challenge?
I think we have been tracking COVID since 2020, of course, from March onwards. But I think, as you mentioned, that the data bit was a bit challenging in terms of, still right now, if you look at the Ministry of Health website, they don't maintain the historical data set. So you have to rely on, open source data set, you have crowdsourced websites like covidindia.org who maintain the historical data. So you have to rely on those rather than, which ideally should be the government, which should be providing you the data. And as and when you are tracking COVID, it's like you have to be constantly on your toe and you have to work with the numbers and make sure those numbers are right. And there are numbers coming from all directions. It's just not the number of cases and deaths. You're also dealing with let's say, oxygen requirement of a country, or you're looking at, the test positivity ratio. And to be honest, when I started working with the numbers, I don't think so that I would have known so many things, so many terms, which all journalists probably agree right now. We are, filled with jargons now, things which we have learned in the last 1 year. It was very difficult. And plus, the thing is, even though you get a source where you can find the data, it is equally challenging in terms of the format, unstructured. It takes more time to clean those things than actually reporting it sometimes. So as Supriya said, if you're in a small newsroom, I'm not talking about myself, but you don't have the privilege to assign someone to clean those up for you, and then you do the story and you analyze it. But as I mentioned, that data can, of course, give you a bird's eye view of what is going on, the scale of the pandemic. But on the ground, the situation was even further grim. It can give you like, okay, fine, this is the problem. Fine, okay, the cases are rising, the deaths are rising. But I can still remember those 4 weeks, with the 4 weeks time when COVID was at its peak, the second wave, and we could hardly sleep because at least somebody, even my entire family was COVID positive. Your friends, your friends who is looking for a hospital bed. They are running from pillar to post to get oxygen cylinder, and it used to cost a lot, like 20,000, 25,000. Sometimes people even paid 50 grand to obtain 45-liter oxygen cylinders. So as a newsroom, I think the idea was basically just to not go overboard, like try to focus on one thing and just track that and make sure that the stories are coming. And automatically the stories were coming in. If I can share my screen, I can just walk you through what are the things we found and how we approach those. Just let me quickly share my screen. Let me know if you can see the screen. Can you all see the screen?
Yeah.
Okay. So the first thing first was, let's rewind to July 2020 when we were asking this question, that is India going to be the next global hotspot? When the cases were rising and India was still not in the country with the highest caseload. US and Brazil were still ahead of us. And initially when cases started to increase, we all know that the testing were not as rampant as we have it now. First, because of the lack of infrastructure, of course, we did not have enough testing centers where people could go and get themselves tested. And there was also a classification of different kind of tests. So more antigen testings were being done than the rapid, the RT-PCR test, which, is more accurate. But the moment you see in this, a second chart, as the government started to increase the daily testing, you see that cases also started to go up. So that was a good indicator. That means, yes, okay, fine. These, tests are being caught as, these are the, but again, that still does not give you the true picture of the cases at that time or even now, because there is also a lot of stigma around COVID. People don't get themselves tested in rural areas because of the isolation protocols, government restrictions. And again, people seeing that as a stigma. Again, back in 2020, we had less testing and reported deaths were far lower. Still right now, we don't know the true picture, the true COVID toll. A lot of journalists are working to find the, even including Supriya, you all have worked to find all mortality data to find the excess death, which has happened in 2020 and 21. But that's still a fraction of what we are trying to see, But at that time, India was just reporting 14.3 deaths per million. That sounds very little to compared to UK, Belgium, or Italy. Again, the biggest factor is the population of the country. India is a huge country. And when the first wave arrived, bigger states were largely hit, like Maharashtra and Kerala and Tamil Nadu. But what is one thing which you need to notice is during the first wave, there were a lot of states which were untouched. Like if you see the far eastern states like Arunachal Pradesh, Mizoram, they had less than 1,000 cumulative cases. Even Bihar and Jharkhand and Odisha, which were the scene were about to change for the second wave, because it traveled from urban districts to the rural districts. In this chart, I mean, if you see that, our first wave's peak was in around September, mid-September, when we hit close to 97,000 daily cases. But that is nowhere close to what happened in second wave. We were reporting close to 400,000 daily cases and over 3,500 to 4,000 deaths in a single day. And one day government decides to revise the death figures, and you realize that there are even more further deaths according to the government estimates. But when you look at the excess death data, then you see that these states have probably experienced 4 times, 5 times, 6 times deaths than the actual toll. But I think that we will know once the government releases all the mortality data, and then we will be able to see what was the exact number of the COVID deaths. In May 2021, right, that was the center, the eye of the second wave. India now had more COVID cases per day than all other countries, cases combined, the whole world combined, sorry. And that is just a fraction to understand what the humanitarian crisis was at that moment of time. In the first wave, we saw migrant crisis. People overnight, they were traveling to the hometowns because all the public transportation was shut, and huge unemployment and everything. In the second wave, we saw more devastation in terms of more hospitalization, more deaths. It was more visible in terms of, we could see the impact of the second wave. And again, when the second wave hit India, it was just not India which was experiencing large, like a huge surge in the number of cases. It was other Asian countries as well. But again, there is no comparison. If you see that Nepal also started to see a surge in cases, Malaysia also started to see, Sri Lanka also, but 7,000, 7,000, 2,000, and you look at 386,000 cases. But right now, when you see, right now, India is not reporting as many cases it was doing 2 months ago. But now the pandemic has shifted to Bangladesh and Nepal. You have seen the similar scene which we saw in India 2 months ago. People are fighting for oxygen beds or intensive care unit beds. Even Indonesia right now, which is reporting high surge in cases. There is always an argument when you as a journalist are reporting stories about like cases and all. People always come to you and say, India is a big country. I mean, if you look at cases per million, it's nothing. But when you look at cases per million as well, this green line which you see here, while all the other countries were reporting lower cases, India was going upwards, and it is on the proportion to the population. So even in that, India was reporting higher number of cases at that moment of time. And also one of the good indicator to understand the scale of the pandemic is looking at the test positivity ratio. So at around 27th of April, India's test positivity ratio went up by 20%, which means that if 10 people were getting tested, 2 were coming out positive. So that is also a good indicator to understand. And it went even further in May, which I don't have the data here at the moment, but now it has come back to not pre-pandemic, I will say, but like at least not 20% for sure. To just give you an overview of the second wave, we were recording close to 4,000 plus daily deaths on an average. And there's one thing interesting, which I'm sure we all journalists have seen in India, is that the government loved showing fatality rate as a percentage of population, whereas vaccination figures as in absolute numbers. Because the moment you do like 250,000 deaths compared to the population, it becomes 1.5% of death, which sounds very minimal, very small. But whereas vaccination figures, which should be proportional to the population, is shown as an absolute number. So 30, 40 million doses in a day, that sounds huge, but that merely covers the population of the country. Interesting thing is that 48%, nearly 50% of the total cases happened in just 2 months. So out of all the cases, 50% of the cases occurred only in April and May 2021, whereas 36% of the deaths occurred in those 2 months. So you can imagine the second wave, the scale of the pandemic, it was so severe, and we all have been through reports on social media as well as amongst ourselves, our friends and family were struggling to find beds and oxygen. This map says it all, because if you look at this map, India is the darkest because India required close to 13 million cubic meter per day of oxygen every single day, and probably the highest in the world. And during the second wave, you can see how the trajectory went just completely berserk. So it was just like a perpendicular line, not even like showing a normal trajectory. So this is the requirement of India's oxygen need. And this is just the data. This is the data which has been recorded. But if you would have gone on ground, you would have seen people lining up in front of the hospital, just like waiting. And I mean, even I have experienced that, going from here to 60 kilometers just to go get an empty cylinder to get it filled so that I can give it to somebody. But every time you go and you don't have a good luck to find that. And which is why you saw a lot of makeshift hospital beds, and the railway compartments are converted into oxygen. For patients. But again, this also sounds great on paper, but the moment you go there and you see, it's not even like, you can't even put a COVID patient because there's no proper ventilation, and there are no oxygen cylinders. So these all also came up when India was going through the second wave. I'll just very quickly go that what drove the second wave. Indian government actually claimed the victory against the COVID quite early in January, February. We all have heard our health minister saying that this is the end game of COVID-19, and which actually, when the government says that, people take that seriously. And you saw people in large number going out, traveling. That one of the data which I think is interesting is when the COVID cases were rising, the vaccination were like going down, which shouldn't be happening, because the moment your cases are going up, you have to vaccinate as quickly as possible. And which is what has been happening in the last couple of months and since last year as well, that the government is using lockdown as a method to curb the virus, which is not a true approach, because when you impose a lockdown, you actually buy yourself some time to do enough genome sequencing, you do contact tracing, you vaccinate people as much as you can. But we had lockdown last year, a very intense lockdown, and this year we had states imposing different kind of lockdowns. Elections were happening while people were lining up in front of the hospital to get beds. One of the elections was West Bengal, and I used this district because this was the longest election exercise for in this year when the second wave was happening. This chart actually gives you an overview of number of cases in different districts of West Bengal. Look at the trajectory, like right here at when the April starts. That's when the election started to happen. In almost every district, you will see a huge upward trajectory of the number of cases. And of course, we had editorial rebuttals from different newspapers that, oh, no, election did not contribute to the COVID second wave in West Bengal. But, the data speaks for itself, because there was nothing, no external agent coming up and pushing of course, we had the similar trend for different districts as well, but, not in every district of a particular state. So which we saw in West Bengal. Kumbh happened. Kumbh is one of the largest festivals in the world, actually, where millions of Hindu devotees go and take dip in river Ganges. And this is the data of Uttarakhand district, where Haridwar is, where the Kumbh takes place. And we looked at the data, and it says that Haridwar is reporting 65 daily cases. But between April 1st and 14th, that's when the Kumbh happened, it is reported 280 cases daily on an average. And Haridwar is not a big city. It's not a big city compared to Dehradun, which is the capital of Uttarakhand. But only these two districts were recording record number of daily cases. And as I mentioned, the pattern of rising cases were similar in almost every urban districts. But it is important to account that it was a mass gathering event and millions attended the festival. So the chances of infection or carrying the virus along with them was much higher. And again, of course, people not following social distancing protocols, relaxing mask usage, and going out in large numbers. So there was a pattern, as I mentioned, that right now you see the devastation of COVID-19 in Bangladesh, Indonesia, similar kind of instances which we saw in India. But second wave spread quickly from urban to the rural parts of the country, and the Delta variant caused more hospitalization and deaths. And this time, nearly every state was affected in the second wave. So as I mentioned earlier in the map which I showed you, far eastern states or Bihar or Jharkhand, there were not enough cases, but this time there were a record number of cases and deaths in these states as well. And I'll quickly run through just the same thing. So challenges to work with data, as you asked Lou earlier. And as I mentioned, that the government does not maintain a central repository of data. So there is no historical data available. So we have to rely on crowdsourced websites like covid19india.org to get access to those data sets. And you have unstructured data set, as I mentioned earlier. And you have to scrape every single website. You have to scrape every information from the websites. So if you are not a coder, or if you don't know if you're limited to the technical expertise, it will be very difficult for you to find those resources to actually do your analysis for you when you're doing the stories. Luckily, I can do it, but I'm sure there are other journalists who cannot do it, and they have to rely on other journalists to do those. So I think the solution is basically we all have done that now, but we collaborate. And if you have scraped something which is a large data set, you share it with other journalists and researchers. For instance, all mortality data compiled and shared by journalists, which they have done it, and they have come out with numbers which shows the true toll of the COVID deaths. And if you have written a script, like for non-coder journalists, maintain a repository or a Google Sheet to simplify data sets. RTI, which is a right to information, which we frequently use to access public information from the government bodies, which we call freedom of information. And also, if you have written a scripts or dashboard, you can give it to the journalists where they can download data sets without much hassle. So these are the things, I just wanted to highlight quickly. If you have any question, please feel free to ask me. Thank you.
I think I'm going to go, we're going to go through a round of questions towards the end, second part of the talk. But yeah, I thought it was very interesting what you said about, for example, the uneven and probably ineffective rollout of vaccines in India. And one thing that I remember since September until very close to the second wave, which was in March, April, the government was doing a lot of vaccine diplomacy. So India was donating a lot of vaccines, and then it kind of came back to bite when the second wave emerged, and we were left without vaccines. And there was a proper shortage, even in cities like Delhi, where, presumably you're going to be better served, there's going to be more, more facilities for people. So I wanted to hear from Natasha what the impression was from outside and how the international community interacted with India's vaccine policy. So what did you make of India's vaccine policy, and how does it compare with other big economies?
Thank you so much for the invitation. So what I was asked to do today was to talk about the international vaccine situation in relation to India. And what you just said about vaccine diplomacy, I think is very interesting, and I'll definitely touch on that as I get through what I wanted to say. But what I thought this is a really incredibly well-known story, especially, it's slightly unfair for me to have to talk about India when I'm not an India specialist. So I thought what would be useful is if maybe with this well-known story, I could offer just some nuances to a lot of the stories we've heard that maybe will give us a little bit of a different perspective. So in March of last year, I became convinced that vaccines would arrive before the end of 2020. And lots of people were saying that that wouldn't happen. But there was every reason to think it would, because that's the experience that we learned in Ebola in 2014. And in 2014, two really extraordinary things happened. There was really rapid attempt at drug repurposing, and the key vaccine development happened in only a 9-month period. And there was talk at that time of mass production of vaccines. So what that means is that what happened wasn't quite so unprecedented, the rapid expansion, and governments should have been more prepared for this. And the reason we know that they should have been more prepared is because the Serum Institute got it. In April of 2020, the largest vaccine making company in the world could see the vaccine would be coming quickly and that the need would be huge. And it was the first pharmaceutical firm of any kind to initiate mass production in the world. And they didn't get any help from the Indian government either. They got help from Bangladesh, from Bill Gates, and if memory serves me, Morocco. So that's kind of point one in the nuance here. What was India thinking at this stage? At that time, all the big pharma firms started to plan for the massive scale up. And at the outset, because I was covering this story, the discussion was, where is this going to be done? And here's the first bit of nuance. Vaccine nationalism and inequity and shortages of the kind we talk today was always going to be an issue. Even if we had waived IP from day one, whatever anyone tells you, this was going to be a massive issue this year. And the reason for that is the way that vaccines are currently made with in a narrow range of well-developed countries. Africa just doesn't have these facilities, and it imports most of its drugs and vaccines cheaply from India. I'm just going to share a little portion of my screen here, and you will see there, you will see a map of global vaccine production. I don't know if that's very visible. So that was the situation, and that was you know, how we kind of entered into the pandemic. Hang on a second, I just suddenly lost my place. So basically, Africa doesn't have these facilities. And where are vaccines made? They're made in America, they're made in Europe, they're made in Asia. And the one thing we knew was America wasn't going to share. America was going to keep all its vaccines. So where did that leave? That left India, that left Europe, and that left Asia. And pharma firms, they know they've got to go from 500 million doses to 14 billion. How are they going to do this? So what they're going to do is, and they need to keep making vaccines for polio and measles, what they're going to do is they're going to go to places that have reliably made vaccines in the past, have the staff and can absorb the investment. And that is exactly what they do. But here's the second bit of nuance. No matter how hard those farms work, all the doses that they plan to make in 2021 are not going to arrive in January. They're going to ramp up over the course. That's just the way that you make stuff. You start by making a little and it gets more and more and more. And here's the thing, every country has sovereignty over its own borders. And so what that means, and I guess this is very critical, you can see this in India, what that means is that any country that's making vaccine in the midst of a health crisis has the capacity to prevent that vaccine from being exported, and will come under a lot of political pressure by its own citizens to do just that. So what pharma companies did is they went to places that had reliably exported in the past, and that led them to Europe and to India. So we hear a lot of stuff about rich countries hoarding vaccine, and let's just say at the outset that vaccine inequity is gross and unfair, and just get past that and let's get on to some of the nuance. I wonder if there isn't some nuance here. America, UK, China, Russia, Italy, and India have all held on to vaccines to serve the needs of their own citizens, regardless of their wealth. It is just a fact that if you have it now, the fact is that vaccines and biological drugs are made in wealthy countries because that's where all the investment has been. And you know, the only place in the world that exported vaccine during a political crisis was Europe. And you could see the political consequences of that during the peak of their wave when there was this fight with the UK over vaccines. And to their credit, except with one blip in Italy, they continued to export vaccines, and that's to their credit. So countries weren't literally hoarding. They weren't sitting on vaccines they weren't using. They were using vaccines that they wanted. The fourth bit of nuance it's worth remembering is that poorer countries, low-income countries, didn't favour the first two vaccines that came out of the gate. That's the Moderna and the Pfizer, because of the cold chain issues and the price. So they were waiting until February, and it was February the 16th when WHO approved the AZ vaccine that was coming out of Serum, that's Covishield. And within a week, you saw COVAX shipping around the world. And that should have been the point at which, I mean, if things had gone to plan, they'd have done about 360 million doses by now, not enough, but certainly some. And the problem, of course, was what happened next in India, because 80% of those doses, those COVAX doses, were coming from India. So when India decides to stop exporting, it has a huge knock-on impact around the world. I've got a lot of maps, but I don't think I'm going to show them actually. But let's just say it on average is going to delay developing countries in Africa and Asia by about 3 months. reaching a 4% inoculation rate. That would be enough to cover their healthcare workers. So, you know, the impact of India's late purchasing, if you like, and late ordering and then export has, you know, that you can count them in the lack of vaccination of healthcare workers. And, you know, I'm not trying to convince you that the way that we've distributed vaccine is fair at all. But I'm just saying there's some nuance here. And the only way we could have avoided a lot of this is if there had been more vaccine making production around the world. And we have tried to do a better job than we had in the past. I know there's been a lot of rhetoric about, you know, vaccine apartheid and HIV drugs taking 20 years to reach countries. But we should still distribute 2 billion doses. It's not enough, let's be clear. But I think it's fair to say that we have done better than we have in the past. The third bit of nuance I kind of wanted to ask is related to middle-income countries like India, like Nigeria, Brazil, South Africa. In the coverage, I wonder if we've, you know, let them off a little bit too easily and said, well, you know, no wonder they did badly, they're not wealthy countries. And actually, these are middle-income countries. And you know, it's clear that they could have done more. And on the question of vaccine diplomacy, one of the questions I would like to see answered is why 5 million doses of the Serum Institute vaccines are in British arms. It makes no sense to me. I can't understand it. And in fact, well, I know why. It's because Britain and India wanted to do a trade deal. And in fact, they wanted an additional 5 million doses. And in fact, they would have probably got it had it not been for the outbreak. And, you know, not only did we keep our borders open to India when we should have shut them because of Delta, causing, you know, another sort of more havoc in our system, we also took vaccines from India, and I think there needs to be accountability on that. And, you know, if you look at some of these countries, whether it's South Africa and Brazil, you know, they're not victims. They've made some bad decisions. South Africa sent back 5 million doses of AstraZeneca vaccine. It was told at the time this was a bad decision by very respected people in South Africa, and now they want those vaccines. In Brazil, you know, Bolsonaro chose to play politics with vaccines. And so I think the reason I raise this is, you know, there's a tendency among journalists to say rich countries and everyone else, and that's not fair. Middle-income countries have much more capacity to determine their own futures, and we can't encourage them to just, you know, shuffle off the blame. They need to be asked now, should they be investing more in vaccines and biotech and healthcare? Why didn't they take this seriously? Why did India not vaccinate earlier? Because I've just no idea why. And here's the kicker. The reason that Africa has little or no vaccine making today is because in our attempts to be kind and help these countries by buying vaccine for them cheaply, that it's not economic, the economic case is undermined for actually setting up vaccine facilities. So that's something that's going to be fixed now. We're going to address that. And governments do need pressure, and pharmaceutical companies need pressure to support that vaccine making around the world, including IP if necessary. So that's, you know, that's kind of pretty much all I wanted to say. I think the other thing I just wanted to say that I do think America has been pretty unfair in the way it has dealt with supply chains. And vaccine supply chains are supposed to be global, and there's supposed to be the free movement of these items. And America has had all the items it needs to make the vaccines in its own country, but it has acted very differently when it has come to exporting materials, particularly to India. And that's a story I did cover. And if anyone has any questions about that, I'm happy to answer that. But I don't want to take up more than my time allotted, so I'm going to finish there.
Thank you. And also, regarding what you said, that reminded me that India has a fantastic record of rolling out successful vaccination campaigns. So, for example, the polio campaign, I think it was rolled out in like a week or something. Like they deployed this little container and went to villages door to door. Whereas now we have this government portal and people have to register and queue for the vaccine. And obviously this leaves out everyone who doesn't own a computer, who can't read or, you know, is challenged.
I think if I'm fair on India, I would say that like many countries, they just didn't expect the second wave to be that bad. They didn't anticipate Delta. And I suppose that's a fair point. But even so, for a country that makes vaccines, a middle-income country that's wealthy, to sort of, to not invest more, I think is pretty hard to understand. I mean, they did buy the 20% COVAX doses, and there was a little bit of extra spending, but it is hard to see why they didn't spend a lot more. And in fact, Brazil certainly changed its tune earlier in this year. So I think India could certainly have done a lot more from about January, even not knowing about Delta.
Yeah. And I wanted to ask about Supriya and Shadab. Now the story, I think, like after the second wave, the story will be about how do we vaccinate the maximum amount of people. And I think one of the challenges that I'm seeing at the moment is to reach remote areas where, the second wave has sort of rippled down from the cities where it first emerged. And now we have all these villages where people are getting COVID, but they're not getting registered. They just get a cough and they get sick with a viral fever, but they don't get tested. Sometimes they die, and these will not be counted as COVID deaths. And then we have the ASHA workers that are now on strike. So there is this huge number of health workers that perform this very essential service, distributing vaccines in rural areas, and they're paid a pittance, like a few rupees a day. So have you been covering this, and where do you think this will be going politically and, from a logistical point of view? Any of you can take the question.
Well, I'd just like to start by saying I totally agree with Natasha that, sort of the failure of the Indian government to place orders for vaccines is just mind-boggling. As the so-called pharmacy of the world, and at least as far as producing vaccines go, we could have ramped up capacity in a way that perhaps no other country could. And the fact that we didn't do it, we didn't. The government thought that it would just be the bully and hold back vaccines when it needed, instead of actually planning and placing orders and supporting the vaccine makers. And the fact that this kind of decision making by the Indian government not only affects us who live in India, but it also affects people across the world, as we're seeing. And that just takes me back to what I was saying at the outset, that somewhere this is also this also shows the current weakness in Indian journalism, that we don't hold the government accountable for these kind of very obvious errors that it makes. And then vaccination, as you point out, again, I would say that for a country that's run like large-scale immunization campaigns, which has a lot of experience doing this, it's really baffling that the Indian state has not pulled all its energies together, and that it's not, again, it's not launched any mass public awareness campaign around vaccines. There isn't enough communication around it at a time when the Prime Minister and sort of all public figures needed to be heard about vaccines. They were out campaigning and contesting elections. And so the priorities were completely misplaced. And then, as you point out, your sort of frontline workers are paid a pittance. They're expected to walk several miles to remote villages to deliver the vaccines. And then actually the other troubling aspect is that this is a moment where sort of the federal system in India is feeling a lot of strain. So to do vaccination, the central government and the state governments need to pull together. But instead, what we saw was that the center was sort of, kind of at war with states over vaccination. So in the middle, in the early phase, when the vaccination numbers started steadily rising, there was a huge dip. So if you see the graph, suddenly numbers plummeted. That was because the center, in a way, shrugged off its responsibility and came up with, again, a policy that made very little sense, where it said that state governments can negotiate directly with vaccine makers to procure vaccines. Now we know that that's like at a time when, you'd have all of Europe pulling together to deal with vaccination. You have India, sort of being pulled apart in sort of different directions. How, at a time when anyway vaccines are not available, how do you expect that state governments would stand a chance it would just make much more sense for procurement of vaccines to be centralized. And so we wasted a good month, over a month actually, in the center-state tussle. And finally, very recently, the center has sort of again stepped back in, and that after the Supreme Court pulled up the central government. And so, the vaccination delays that we're seeing in India is just a cascade of bad decisions. And, at this point, we are in July and only like less than 5% of India is fully vaccinated. And I don't know how many weeks or months, away we are from the third wave, and whether, our vaccination numbers will actually go up further in time to, hopefully before another new variant emerges. And if I may just also add that, Natasha brought up the Delta variant, and that also is a rather shocking case of the government not, again, its communication, as Shadab pointed out, was sort of all very cheerleader type. So all the press conferences were about emphasizing how India is doing very well. Well, look at our, recovery rate. That's a term that perhaps no other country has used. That people are recovering from COVID, and that is, India has the best rate on that. So, the whole thing was just sort of very much to rouse the Indian public and say that we are doing better than the rest of the world. And that meant that they were not sufficiently acknowledging what was emerging, which is that the Delta variant had been detected in India last year. And by February, there were 2 districts in Maharashtra which was seeing a 2,000% jump in cases within a matter of a week, which was a clear sign that there's a new a highly infectious variant out there. And the government should have used its press conferences to communicate this to the rest of the country, so that everybody can take better, safety measures. Instead, they didn't do that, and they kept suppressing information. There's not enough genome sequencing. We have more data on the Delta variant after it spread outside India, and we actually, as journalists in India, follow Public Health England to understand a variant that actually is rampaging through India.
I just wanted to say, in terms of like the vaccination program, if I can share this, there you go. You can see from some analyst data when you expect to fully vaccinate. So that would be 48% of adults by October. And the purple line is at the bottom, is a slowing down if India decides to export 50% at that stage, which it may not do. So there you go. I don't know if that's helpful.
I just wanted to open the floor to questions that are coming in. So one is, I think for Shadab mainly, do you have or are there any data on infections after vaccination? This is something that we're hearing over and over in India. I know a dozen people were infected after the first dose, whereas government data that in fact says that infection rate after first and second vaccination is very low. But it is true, it's something that we're finding. I think you guys here and there might have heard similar stories, like people getting 1 dose or even 2 doses and then getting COVID-19 really, really sick again. In the UK, the story is a bit different because at the moment there's a big wave, lots of cases, but very few people are hospitalized and very, very few people are dying. So do we have information? What's the knowledge, the current knowledge of this?
So, I mean, India, like the CoWIN, which is, that side where we have vaccination data, they do release AFI data, which is the adverse events following immunization. But that is of no use because we don't know which vaccine is causing, what effects, because we know that, okay, fine, 5 AFI events happened in Punjab on a particular day, but we don't know either it was because of Covishield or Covaxin, of what age group, we don't know that. So we did have, I think probably we had like 2 public data which was released to journalists that, okay, fine, like what were the gaps? Like, for example, if somebody took Covishield and what was the gap? Like how many days did it take him to get infected with the virus, or any effect after the virus, or the person died? Was that between 1 to 3 days or between 5 days or, henceforth? But we only had like 2, and that was a very small sample size. So we cannot really extrapolate what is happening in the entire country. So the AFI data which we see on COVID website is literally worthless. I mean, I don't see a point of seeing that because it doesn't make sense to us. And later on, the hospitals started to release the data on the vaccine, that, the efficacy, of course. So what they did was, like, for example, what I can think of right now is Max Hospital, which they released the data about. They took the sample size of close to 14,000 frontline workers, and they assessed them that, what was how many of them got reinfected after taking the vaccine, and after taking the first dose, and also after taking the both doses. So you see, like, of course, there's a very small percentage of people which got reinfected, at least, and those who got reinfected, there was a small proportion of that, sample size who was severely, probably they did not have to go to the hospital to get treated, and only like a very minimum percentage who needed ICU bed. So, we have to rely on private hospitals' data to find out, whether the vaccines are working or not, right? But if you talk about the government data, they only release AFI, which does not make sense.
Right. So another interesting question, I think, for the Indian contingent. This is something that every journalist that works in India for Indian media will have, asked themselves, and it's how do you get around the focus of the government that wants to make the news just about their own message. It's a bit like what you were saying about, blowing their own trumpet, saying, the things are going really well, there's recovery rates are very high. How do you go about counteracting or providing a balancing perspective without fear of repercussion? Because we hear over and over of journalists that get, harassed online, or they receive FIRs, which is a particular sort of chilling tool where you get, it's not a criminal charge, but maybe you'll be able to explain more. It's something that, brings you in front of the law, and it's not quite a lawsuit, but it's something that will create problems for the individual. So if you can explain more a bit about that for the people who are not familiar, and share your advice on how to go about this.
Shadab, would you like to go?
Or quickly, you can both go, and it's like it's not.
Just to say, I have an FIR against me. So it's an FIR is a first information report. That's when the police basically accepts a complaint and says that they will begin an investigation. And I mean, there are far too many journalists in India right now who have FIRs against them, so there's nothing novel about it. I don't know. I mean, I guess when it becomes so common, then you just sort of shrug your shoulders and you say, let's just get on with your work. And there's not a way to do this. That when it's, again, a lot of the stories that sort of stand out sometimes in India, I also feel a little sad to see that they're not necessarily stories that were sort of like, we didn't produce something like really earth-shattering. We just produced good journalism, which at any other time would just have been, half the course. But it just stands out now because there is very few outlets doing it. And so the rest of the media seems to amplify the government narrative to a point where the few news organizations that basically are just doing good traditional journalism, they come across as like these sort of brave independent watchdogs. Well, actually, what we're doing is just like basic journalism.
Shadab, I know that the situation with BBC is a little different because there's also quite a bit of suspicion towards the BBC being a foreign media. I know that the Delhi bureau hires only Indian correspondents, Indian journalists, but there is a bit of that as well. So how do you navigate this kind of difficult situation from two sides?
I think, sometimes we often get confused with the balancing part that, you don't have to, of course, you can take, balance is not about taking the quotes from two sides, right? And And when you do stories and when you're speaking the truth, you can never think of, okay, how do I story that without getting FIR filed? You can't do that, because when you are doing a story and you think you are making somebody like government accountable, and they will be in in trouble, for example, for not doing certain things which they're supposed to do. And there could be repercussion, and you can't just say, okay, what, I will not do this story, or I will drop this story because there will be repercussion. Like, for example, I'll give you a very good example. Whenever you do a story around UP, like Uttar Pradesh, that there are high chances you will get an FIR, anything you do. So either it is ground reporting, or either you do a data. Even like sometimes we have gotten rebuttal from the government that what you have been sharing is wrong. We have gotten email from the CMO office as well. But the moment, and those are the figures we have cited from the government sites. We are not making it up, and we have to reply back to them. Look, we have gotten these figures from National Crime Record Bureau, which is a central agency which collects the crime statistics. But they're like, no. We have our own local data, which is never public. And this is what it is. They will take the screenshot, a very shoddy screenshot, and they will send it to you on email that you have to correct yourself. But again, I think I have been lucky enough that because BBC is a big organization. So if you are speaking truth, of course, people, your editors will support you, even though if there is a legal case against you. And I'm sure it is the same in Scroll as well. But again, the thing is, as Supriya said very rightly, that it keeps coming. You can't stop. It's a daily affair. You keep doing the stories, and BBC being anti-India. I don't know. People, any organization which does make the stakeholder accountable, people see that with a different lens, I think. So I think we have to keep doing our job. I have nothing more exciting to add. So.
Okay, I see Marina is back.
Yes, that's me, and we're running out of time. And I just wanted to thank all of our speakers who joined us. Thank you very much, and to Lou for hosting it, and everybody who's attended. Remember, we have more talks. We have another one coming up at 3:30. It's all free. We have 2 more days of free talks and discussions. Please join in. Please share. Please bring your friends. We don't, because it's online, we can have people from India, we can have people from all over the place, which we normally can't afford. So please come and use this opportunity to see great speakers. Thank you very much, everybody, and we'll see you hopefully very soon.
Thank you. Bye.